Hello everyone, welcome to the Tim Booker channel. Wishing you a pleasant listening experience. Today, the book I'll be interpreting for you is The Digital Pill, subtitled, What Everyone Should Know About the Future of Our Healthcare System. In this rapidly advancing digital era, the healthcare domain is undergoing unprecedented transformations. From treatment methodologies to patient management, emerging technologies like cloud computing, big data, and artificial intelligence continuously reshape this industry. The Digital Pill delves into this phenomenon, offering a comprehensive and profound exploration. Authored collaboratively by 3 Swiss scholars, including Andreas Hermann, a professor of marketing at the University of St. Gallen, Elgar Fleisch, a professor in information and technology management at ETH Zurich and the University of St. Gallen, and Christoph Franz, a member and consultant of the International Committee of the Red Cross in Geneva. Their diverse professional backgrounds not only cover medical analysis but also introduce discussions from technological, product, and marketing perspectives. Within the book, they discuss numerous practical cases in today's digital healthcare domain. They conduct interviews with relevant professionals, outlining the current state of digital healthcare technologies while also presenting a series of limitations and challenges faced by these technologies. However, they emphasize that technology is just one aspect. As the authors state in the preface, they aim to leverage the various opportunities digital technology can bring, dissect the patterns and concepts of healthcare systems, and thereby explore how these systems can better serve people. Without further ado, I'll break down this book into 2 parts for you. Firstly, we'll delve into the dilemmas confronting modern healthcare systems and what digitization can do in response. Secondly, we'll explore a set of real-life cases in digital healthcare, aiming to understand the current status of digital healthcare development. Let's start with the first part. Extraordinary achievements have been made in modern medicine, an indisputable fact. Over the past 100 years, human life expectancy has doubled, from 40 to 46 years in the early 20th century to the current 69 years. However, viewing this achievement from a different angle, it has both positive and negative aspects. As the authors put it, these remarkable advancements might be the very reason modern healthcare systems are overwhelmed. Why is this said? People today live longer, yet it doesn't necessarily mean they are healthier. Medical progress has reduced the fatality rates of certain diseases, but the consequence is enduring the prolonged suffering caused by these illnesses. Towards the late 1990s, health economists introduced a measure called disability-adjusted life years, or more explicitly, years lived with disability, indicating the time people spend impacted by illnesses. In 2016, the global burden of disease accounted for a total of 776 million disability-adjusted life years, signifying an increasing number of individuals enduring the torment of diseases day by day. According to the World Health Organization's predictions, by 2060, non-communicable chronic diseases will double compared to present rates. Based on these data, the authors assert in the book that in the 19th century, infectious diseases were the medical nemesis, while in the 21st century, medicine faces a new adversary, non-communicable chronic diseases. Common non-communicable chronic diseases encompass 5 types: cardiovascular diseases, chronic respiratory diseases, diabetes, mental illnesses, and cancer. These illnesses don't result in immediate fatality but cannot be immediately cured either. Take diabetes as an example. According to a research report from the American Family Physician, the average age of diagnosis for diabetes cases in the United States decreased from over 50 in the late 1990s to 46 in 2000, and this trend continues downward. Once diagnosed, diabetic patients must continually control their diet, monitor their blood sugar levels, and take medication daily, maintaining these habits for decades. Poor management can elevate the risk of artery and kidney damage. Moreover, diabetic patients heal slowly from ulcers and wounds, leading to significant inconvenience from even minor injuries, requiring prolonged medication or even limiting their ability to walk long distances. Their family members also must devote extensive time to care for them, enduring immense caregiving pressure. Additionally, beyond physical suffering, non-communicable chronic diseases inflict significant economic losses on society and families. According to statistics from the World Economic Forum and the Harvard School of Public Health, in 2010, global expenditures on non-communicable chronic diseases nearly reached $63 trillion. This equals the combined gross domestic product, GDP, of Japan and South Korea. Estimated projections suggest that by 2030, these costs will more than double, reaching over $130 trillion. The high costs stem from two main reasons: the large affected population by non-communicable chronic diseases and the ongoing expenses over decades due to treatment, including direct and indirect medical expenses, along with reduced income caused by illnesses. This actually illustrates the second negative consequence of medical progress. Undoubtedly, it's becoming more advanced, but it's also unquestionably becoming more expensive. Medical care costs in various countries worldwide continue to rise. Hence, despite having state-supported healthcare systems that subsidize some medical expenses and healthcare insurance companies that share risks, diseases remain one of the most significant factors affecting personal finances. In most African and Asian countries, the majority of medical expenses are borne by patients themselves, leading to the continued prevalence of illness-induced poverty. However, the situation in the United States isn't much better. While the U.S. enjoys enormous dividends from medical progress, boasting rapid advancements in medical research and drug approvals surpassing other countries, its healthcare costs are exorbitant. The book mentions that 28 million Americans lack any health insurance, depriving them of access to advanced medical services and potentially plunging them into substantial financial crises. In the U.S., the most common reason for personal bankruptcy is the inability to afford medical expenses. Global healthcare expenditures are escalating, far surpassing global military expenditures. This is a positive indication, demonstrating a global emphasis on health issues. However, when comparing the growth of healthcare expenditures to the growth of gross domestic products, GDP, worldwide, concerns arise. The growth rate of healthcare expenditures far outpaces that of GDP, indicating that ordinary households must allocate increasingly more disposable income towards healthcare, a trend that is evidently abnormal and unsustainable. Taking Switzerland as an example, in the past 20 years, healthcare system expenses in Switzerland have far exceeded total healthcare insurance payments, necessitating substantial subsidies from the government. Nevertheless, the proportion of out-of-pocket expenses for healthcare has continued to rise. Germany faces a similar situation. In 2000, Germany's total national healthcare expenditure was €214 billion, increasing to €375 billion by 2017, exerting significant pressure on the country's healthcare payment system. The situation in the UK is somewhat different. The National Health Service, NHS, was established in 1948, aiming to provide free and comprehensive healthcare services for all British citizens. However, in recent years, the NHS has faced increasingly tight finances, resulting in patients enduring long waits for surgeries and increasingly limited choices in physicians. If even these countries face these challenges, it's even more pronounced in other nations. In summary, the rising costs of healthcare are a common issue confronting all countries worldwide. So, what can be done? According to the authors of this book, digital healthcare might offer an effective solution. Previous discussions on digital healthcare mostly framed it as a tool aiding diagnosis and treatment. For instance, I've interpreted a book called When Medicine Goes Wrong, which detailed doctors' experiences and thoughts using electronic medical records and intelligent diagnostics. However, the perspective of this book's authors differs. To them, the primary role of digital healthcare isn't in aiding treatment but in aiding prevention. For most non-communicable chronic diseases, prevention might be more crucial than treatment. In the author's words, prevention is the best treatment. According to a WHO report, about half the risk of non-communicable diseases can be controlled by individuals. Take cardiovascular diseases, for example, people can reduce their risk by 80% through prevention. This prevention largely involves lifestyle adjustments, including 4 aspects: healthy diet, adequate exercise, smoking cessation, and moderate alcohol consumption. Even cancer risks can be reduced by 30% to 50% through lifestyle adjustments. In 2010, the WHO collaborated with UN member states to set global goals for controlling non-communicable diseases and standardized measures to gauge their progress. For instance, goals were established to reduce tobacco consumption and salt intake by 30%, decrease alcohol consumption by 10%, and reduce the inactive population by 10%. Unfortunately, implementation of these goals and methods has been remarkably slow, if not disappointing. In 2017, the WHO specifically urged member countries to expedite relevant matters, aiming to achieve these goals by 2025. According to the authors, the primary challenge lies in the difficulty for policymakers to directly intervene in shaping residents' lifestyles. It requires a collaborative effort across multiple systems including health, education, publicity, and law. To the authors, digitization might offer a breakthrough. Nowadays, digital technology permeates almost every aspect of our lives, greatly influencing and even transforming our lifestyles. If we can embed preventive medicine concepts in digital technology, it might expedite the integration of preventive medicine into daily life. Additionally, digital technology could enhance the efficiency of healthcare systems and help control excessive medical expenses. Despite the existence of digital technology for many years, the healthcare sector's entry into the digital age has been exceptionally slow. In many countries, communication between doctors still relies on handwritten referral letters if a patient switches hospitals or doctors. As a result of data silos among different healthcare institutions, new doctors are unable to immediately access patients' past medical records and treatment histories. Consequently, patients have to shuttle between several healthcare facilities, undergo redundant tests, waste time, and incur additional expenses. A study by the New England Healthcare Institute revealed that 30% of healthcare expenditures in the U.S. are unnecessary, and reducing this portion wouldn't negatively impact the healthcare system. A significant reason for this is the inefficiency in treatment. For instance, in the emergency department, statistics indicate that 71% of cases could have been avoided using non-emergency approaches. Among these cases, 24% were not emergencies, 40% could have been managed by primary care physicians, and 10% didn't require medical attention at all. Imagine if digital technology could facilitate scientific triage beforehand, it would significantly enhance emergency department efficiency and avoid unnecessary expenditures. Specifically, the book mentions a company called Oscar Health Insurance in the U.S. that developed a chatbot effectively guiding patients to choose suitable healthcare services. For instance, when a patient experiences a urinary tract infection on a Saturday evening, a time when regular clinics aren't available but the situation isn't severe enough for emergency care, the chatbot suggests options like remote consultations, achieving triage goals and reducing medical expenses. Alright, we're done discussing the challenges facing healthcare systems today and the role that digital technology can play in this context. Moving on to the second part, let's delve into specific cases to see how digital technology is currently being applied in the healthcare industry, what its effects are, and what considerations we need to bear in mind. Self-health monitoring might be the most familiar form of digital healthcare for the general public. Even before the age of smartphones and the internet, some athletes or chronic disease patients would measure and record their vital signs and various activities daily. Today, aided by various smart devices, this monitoring and recording have become increasingly convenient, accurate, and comprehensive. The data collected can serve as crucial references for diagnosis, treatment, preventive measures, and lifestyle adjustments. Numerous companies are deeply involved in this field, with Apple taking a prominent position. After the FDA approved the electrocardiogram feature on the Apple Watch, the company swiftly constructed a digital healthcare system around this product. They developed HealthyKit to collect health data gathered by Apple hardware and software and created CareKit to assist medical institutions in obtaining patient health data. ResearchKit established channels between patients, hospitals, and medical research institutions, attempting to foster collaboration among medical researchers. Additionally, some companies are aiming to create incentive mechanisms based on personal health data to encourage healthier lifestyles. For instance, in Canada, a collaboration between government departments and private enterprises launched an app called Carrot Rewards. Users could earn points by actively engaging in sports and then exchange these points for discounts at cinemas or supermarkets. The app was highly popular, with over 1 million users, significantly promoting healthy lifestyles. Besides monitoring, digital technology is also propelling the development of self-service medical testing. Traditionally, common testing procedures required patients to visit clinics or hospitals, provide blood, urine, or other samples for analysis, and then wait for days or weeks for results. Digitization speeds up this process in two ways, enabling more tests to be self-administered at home with immediate results and allowing patients to purchase medical testing services online, collect and send samples from home, and receive results via the internet. For example, in terms of urine tests, there are several self-test products available in the market. The testing process is straightforward. The patient collects a urine sample, immerses a test strip in the urine, takes a photo of it, uploads it to the corresponding app, where AI algorithms check for any anomalies in the photo and decide on the next steps, which can be effective for the preliminary screening of chronic kidney disease. However, self-testing also has its controversies. The authors point out in the book that while self-testing enhances privacy, convenience, and speed, and reduces testing costs, the lack of professional medical interpretation of test results can lead to unnecessary anxiety, inevitable misinterpretations, and misdiagnosis. The authors specifically mention a blood testing company called Theranos in the book, founded by Elizabeth Holmes, dubbed as the female Steve Jobs. The company claimed to have developed a self-service blood testing device, attracting substantial investments and reaching a valuation exceeding $9 billion at one point. However, it turned out to be a scam, and in November 2022, Elizabeth Holmes was sentenced to 11 years and 3 months in prison for defrauding investors. Using this case as an example, the authors call for the healthcare industry to enhance the accreditation qualifications of self-testing institutions, ensuring the safety and reliability of medical testing, and providing reliable and easily understandable guidance to prevent customer misunderstandings. In the specific medical treatment process, digitization has also played a significant role. Online consultations, online medication purchases, and other medical services need no elaborate explanation as they have become familiar healthcare methods today. What I want to emphasize here is the virtual doctor service based on artificial intelligence technology. As we've discussed earlier, treating chronic diseases is a lengthy process that might involve various aspects of life. Virtual doctors serve as an effective means for this kind of treatment, providing patients with long-term services such as companionship, advice, monitoring, consultations, and assistance. Currently, many companies are launching such virtual doctor services, and the field keeps subdividing. For example, the book introduces a Finnish company dedicated to treating depression and anxiety. Its core technology is a chatbot that sets daily behavior therapy exercises such as mindfulness and meditation for patients and maintains constant communication with them. Data collected indicates the effectiveness of this technology, with 75% of users showing decreased scores on the depression screening scale after 12 weeks, signifying a reduction in depression levels. The authors state in the book that ensuring convenient, long-term treatment for patients struggling with mental illnesses is crucial. Still, due to society's limited awareness and acceptance of mental illnesses, this is often challenging to achieve. Leveraging virtual doctor services might help lower the barriers to psychological therapy, allowing patients to receive psychological relief and initial treatment anytime, anywhere, at significantly lower costs than traditional therapy methods. Apart from assisting patients in achieving better treatment outcomes, artificial intelligence can also help doctors make faster, better decisions. In medical decision-making, a substantial number of decisions rely on ultrasound, X-ray, CT, MRI, and other medical imaging. The misinterpretation of medical images during the medical process has led to countless medical accidents, causing severe impacts on patients and adding subsequent costs to the healthcare department. This is precisely where artificial intelligence can excel. In the US, a company called Unveiled uses vast amounts of radiographic images and corresponding diagnostic results to train AI to recognize X-ray images. Tests have shown that AI's speed and accuracy in image recognition far surpass those of radiologists. Even for detecting rare tissue lesions, AI's performance is superior to radiologists due to its vast image retrieval and comparison capabilities, as well as its ability to integrate and analyze patient medical data. In China, companies like Wisian AI, established in 2009, are also advancing the development and application of this technology, providing medical image analysis services. Currently, it has collaborated with more than 1,600 hospitals, helping alleviate the shortage of radiologists and oncologists in China and promoting screening projects for diseases like lung cancer. Furthermore, we can't overlook the application of digital technology in drug development. A considerable portion of the increased healthcare costs stem from rising drug development expenses. In the 1970s, the average R&D cost for a new drug was $179 million. By the 1980s, this figure doubled, and today, the average cost from in vitro evaluation to market approval for a new drug has skyrocketed to $2.5 billion. Simplifying the drug development process and reducing R&D costs using digital technology is a significant concern for many institutions today. In the book, the authors introduce 3 effective methods currently applied. The first is using computers to assist in drug discovery. Previously, researchers had to spend years in the lab, going through extensive trial and error processes to find a drug. Even before digitalization pervaded various social domains, laboratories had begun using robots to execute highly precise repetitive tasks. Nowadays, robots are becoming increasingly intelligent. They are not only capable of performing repetitive tasks but also cognitive and research-related tasks, enabling them to play a significant role in tasks such as screening candidate drugs. For instance, Cambridge University has developed 2 laboratory robots named Adam and Eve. These robots can propose hypotheses, test them, and adjust hypotheses based on experimental results to swiftly identify potentially effective drug components. Previously, they assisted researchers in discovering candidate drugs for various tropical diseases. Although the research results are currently at the in vitro stage, once confirmed in clinical trials, the work of these 2 robots could potentially benefit millions of people. Apart from drug discovery, digital technology can aid in recruiting patients for clinical research. Clinical studies often face failure due to difficulties in patient recruitment. It's not that patients are unwilling, rather, they are unaware of such studies. According to a study by the National Institutes of Health in the U.S., 85% of patients are unaware that they can participate in clinical research. Additionally, 75% of respondents expressed openness to participating in clinical research. Therefore, the key to recruiting patients lies in disseminating information to the relevant audience. Some commercial entities are attempting to address this issue by establishing a platform that aggregates relevant information. Patients can use such platforms to find suitable research projects for themselves, while researchers can quickly match patients meeting the experimental requirements, significantly improving patient recruitment efficiency. Moreover, digital technology can assist in incorporating real-world patient data into drug development processes. Here, real-world data refers to health data generated from various aspects of a patient's daily life, including medical visit information in electronic medical records, vital signs and activity data monitored by health wearables, and even billing information from health insurance companies. It encompasses data accumulated from a patient's pre-disease to post-disease stages over the long term. This data may not be as rigorous as clinical research data but might more accurately represent real-world patient responses and needs. The application of AI technology allows us to systematically assess and utilize this often overlooked data, offering a more comprehensive and practical perspective for drug development. For instance, in Alzheimer's disease research, previously, data could only be collected from diagnosed patients. Now, with all electronic medical record information stored in databases, researchers can review patients' past conditions, enabling a better understanding of factors influencing disease progression and taking corresponding measures. However, digital healthcare also raises concerns that require our attention. The book particularly emphasizes data security issues. All the digital healthcare services we mentioned earlier are built on health data containing highly personal and individualized information. Once leaked, the consequences could be catastrophic. Serious health data breaches have occurred in countries like the US, the UK, Australia, Singapore, Germany, and South Africa. According to data released by the US, between 2009 and 2018, there were 1,863 health data breach incidents affecting 173 million individuals. Moreover, with an increasing number of medical devices connecting to networks, healthcare companies have become prime targets for cyber attacks. In the US, over half of successful network attacks have targeted healthcare companies. The shocking reason behind this is that the price for a stolen electronic medical record is 10 times that of a stolen credit card on the black market. This is because electronic medical records contain a person's social security number, medical insurance number, address, and credit card information. Criminals can use this information to apply for multiple new credit cards, obtain loans, make purchases, etc. The authors assert in the book that solving this problem requires efforts on two fronts. Firstly, raising awareness and operational skills regarding data security among healthcare practitioners and patients, as many data breaches result from human errors. Secondly, it is crucial to leverage technology adequately. Data security should be considered from the design stage of devices and software rather than as a remedial measure afterward. Regulatory bodies should also strengthen standards and supervision of data security, ensuring comprehensive attention to data security from hardware and software to system architecture and usage concepts. Additionally, the book prominently highlights the fairness of technology. Fairness is an essential ethical and moral principle in modern medicine, demanding fair distribution of scarce medical services and equal treatment for similar cases. It also requires the fair distribution of the burdens and benefits of new or experimental treatments among all social groups. Currently, digital technology evidently increases people's access to healthcare services. However, many low-income families, elderly people, individuals with disabilities, and rural residents still face challenges in enjoying these opportunities. This is not only due to their economic status but also because they lack stable internet connections, necessary devices, or the skills and education required to use these digital tools. For these individuals, digital healthcare may not necessarily make healthcare more accessible, instead, it might become increasingly challenging. Additionally, at present, there exists a significant gap between different systems and devices in digital healthcare, which might further exacerbate inequality. For instance, compared to Android users, Apple users have access to more advanced health monitoring and analysis tools. This is not only because Apple devices are generally more expensive but also because Apple Incorporated has access to more sensitive and advanced health data. Such discrepancies could likely lead to significant differences in medical outcomes between two different user groups. Based on this, several authors in the book particularly emphasize that the design and application of digital healthcare services need to focus more on fairness. This includes but is not limited to providing more universal and affordable internet services, conducting digital health education for different groups, and formulating fair data sharing and usage systems. Only when these issues are adequately addressed can digital healthcare be expected to drive healthcare systems to better serve people. Alright, the book's content has been introduced. Now, let's have a recap and summary. The three authors have provided an analysis of some achievements in the field of digital healthcare. In the first part, they discussed the dual nature of medical advancements, reducing fatality rates while necessitating enduring suffering from diseases. Severe and chronic ailments, despite becoming less life-threatening, now significantly impact personal lives. Additionally, as technology advances, it becomes increasingly expensive. Many countries witness healthcare expenditure growing faster than their GDP, meaning healthcare costs will encroach more on disposable income. The authors propose digitization as a major strategy to address these issues. Digitization can promote healthier lifestyles, emphasize prevention over treatment, and effectively enhance the efficiency of healthcare services, thus reducing costs. In the second part, specific cases were presented, including self-health monitoring, self-diagnostic medical tests, and the application of AI in chronic disease treatment and physician diagnoses. Furthermore, the authors mentioned the use of digital technology in the drug development process, such as aiding drug discovery, facilitating patient recruitment for clinical studies, and incorporating patients' real-world data into drug development, all of which expedite drug development processes and lower costs. However, despite these benefits, digital healthcare raises concerns in two main areas: the security of health data and the fairness of technology. Only when safety and fairness are ensured can a medical technology genuinely benefit everyone. That concludes the entirety of the content provided for you. Congratulations on completing another book. Thank you all for your support and attention. Please subscribe to the Tim Booker channel, like, and share this valuable knowledge with friends. Let's combine wisdom with practice to achieve our financial goals and create a better future together. Thank you, goodbye.